Hello, and welcome to Memorial Healthcare System's Skype chat, where we'll be bringing you helpful tips from specialists throughout the system about how to keep yourself and your family safe and healthy during the COVID-19 pandemic. Today, I'm excited to talk to Sunny Levalle, a registered dietitian who specializes in weight loss and bariatric surgery at Memorial Healthcare System, about stress eating. So tips on eating healthy foods and limiting the unhealthy foods. Hi, Sunny. Thank you so much for joining me today.
Thank you so much for having me. I'm so excited to be here.
I am too. So as we cope with the new normal of sheltering in place for the next several weeks or months, a lot of people, including myself for sure, may be prone to overeating or eating while stressed because why? We're stressed out and for obvious reasons. And in turn, we start picking up a lot more weight. So my first question is, what are some tips for curbing stress eating? And really, maybe you could just start with the definition of stress eating.
So stress eating it's actually a normal physiological feeling, because when we're stressed, from back in the day when we're stressed, fight or flight response, our body will actually start craving what we think it needs, which is immediate energy, which is sugar. So during times of stress, there is an increase in stress hormones, most notably cortisol, and that actually leads us to crave that instant energy, which is high sugar foods, high calorie foods, processed foods that really are unhealthy, which lead to a vicious cycle of, that instant energy, that instant high, if you will, instant gratification, but then will lead to that downfall of actually feeling worse and wanting more of those foods, which again turns into that vicious cycle.
So what are some tips for curbing stress eating?
Number one, you really want to ask yourself, am I physically hungry? We are inside, we are bored, we are kind of walking from room to room and maybe, passing the kitchen, the refrigerator, the pantry. Oh, yeah. And when we have gone shopping and kind of took things off the shelves, some more than others, we probably have taken foods that are comfort foods or foods that are processed, high in sugar, and we have those in our kitchen. And so having them just, even if they're out of sight, we know they're there. So that's number one. Maybe you already have them and you've, gone through them already. And I don't want people to beat themselves up about having that, that stressful evening or that day where they were, maybe not perfect that day, because we are all dealing with stress, and it's okay to have that one or two little, small binge, if you will. But we don't want it to be an everyday thing. So what I say is, be mindful of what you're going to be buying at the supermarket. Don't buy those things that are going to be in your refrigerator, or especially your cupboard, that are high sugar and processed, that you will lean to when you are stressed. Because even though you don't actually see it, out of sight, out of mind, it's in your kitchen. So just don't have it. That's number one. But ask yourself, am I hungry or am I bored?
So what are some foods that people should look to eat during these times of stress?
Best foods are foods that don't cause an inflammatory response. Because foods that cause an inflammatory response increase your stress hormones, most notably cortisol. So you want to pick foods that don't do that. So number one, high protein foods like your turkey, your fish, your chicken. And a lot of those things you can buy that are non-perishable, things like salmon, cans of tuna, even beans, even they have wild salmon in packets or cans. So things like that. But the tryptophan that's in these proteins actually leads to a creation of dopamine. So that actually helps us feel better and more calming. So we also want to lead to more fiber-rich foods. If possible, your green leafy veggies, they have folate, which also produces dopamine as well, and will also make you feel more calm. So that combination of protein and fiber will also fill you up.
So my last question is telehealth. Memorial Healthcare System has implemented and transitioned a lot of its appointments to telehealth, which is an awesome way for patients to still keep their appointments with their practitioners. Could you tell us a little bit about that?
Telehealth is such a great application that is accessible through MyChart. And it is so helpful, especially now when we can't be with a practitioner or your nutritionist or whoever you're seeing face to face. It's a way to have your visits to be accountable for. I know me being a nutritionist, nowadays it's been a little stressful for people, maybe going off track, and I'm able to see them and they feel like they're more accountable for what they're doing. So I'm really happy with having this application. But it's really simple. It's you can download it through My Chart, and you have to just fill out a couple forms to get access to it, and it's quite easy. You're able to log on, dial in through an iPad, iPhone, your laptop, as long as it has a camera, and you'll be able to be seen by your practitioner.
Perfect. Thank you so much, Sunny.
You're so welcome.